and it shows you that there's a premium on security and military institutions as opposed to listening to what doctors and other such professionals have to say.
Health workers, this pandemic was described among others as a war. The frontline soldiers in this fight are the health workers. If they are crying for their salaries, if they are crying for their allowances, then that for me is not an indicator of a government that cares about its people and the health of its people. But you asked specifically about ANT.
Yes.
What should be our approach? Number one, like colleagues have stated, none of us is opposed to responding to COVID-19. COVID-19 indeed is a global pandemic, and we have seen what it has done in other places. But by the way, in this slide, I also want to debunk the notion by Honorable Nyamtoro that because she said millions died in Italy and London, that's not true statistically. But even if it were, it is not true that because people have died elsewhere, then that justifies the inefficiencies within. We know that
possibility of a national lockdown having no economic impact. It is not there in any nature of society within our generation. Why? Because there is no country that operates on 100% e-commerce. There is no country in the world that operates on 100% virtual business environment. And so lockdowns have had impact on each and every economy. I want to remind everyone in this panel that Uganda, not by our own PR ranking, but by the rankings of the World Health Organization and the World Economic Forum, was one of the best performing economically, but also in terms of management of the pandemic. And so being among the top 10 performing countries in management of what is a dire economically hard-hitting pandemic, when you're from the third world, should speak to what you want to say, the leadership of our country.